Hey, good morning, good morning, good morning. Happy Saturday. Happy Saturday. Happy Saturday. So, if you are joining me this morning, do me a favor click like, share, and subscribe. Click like, share, and subscribe. I'm going to be getting into a lot of things this week, issues that are on our or resolutions which were on our agenda and topics and how do we start to bring this community together, whether we like it or not. At some point, we have to move towards the same goal. So I'm gonna get into a lot of different things. I'm gonna have a special guest this morning. Her name is Reverend Monica. You often hear her go by Pastor Monica. She's gonna be on shortly after, but we're gonna get into the greetings. So do me a favor, drop in where you're from, drop in where you're from, and we're going to discuss it all. We're going to discuss it all today. So, um, good morning, Jeff Johnson, Christopher Sims, Lil Mama, Jasper Burke. Is this what we doing? That was the question for the week. Is this what we doing? That is really like a topic. Sydney Green, Adams Barb. I probably flipped around Barb Adams. Mr. Thomas, I need to share this out too because I have not done this. I ain't going. Good morning, super producer. Good morning. For the first time I saw super producer, I think she was on the bump this morning. Miss Richburg, Rhoda Murphy, Nisi 1025, Miss D. Listen, I'm gonna share this out. We're gonna get into a lot of things, and I want to make sure that I am being a steward of good information. One thing I try to make sure is that I'm transparent. Am I perfect? No, not even trying to be that. No, I'm just trying to be me. Good morning, Sean Simpkins, Sarah Perino, Monica Talbert, Keisha Denise, and then Denise, Carolyn Hendricks. Listen, click like, share, and subscribe, and please push this out because there's some good information. When you do your real research, you really find out, and my opinions are based on when I make a decision, what I'm comfortable with, what I have taken my time to be up 2, 3, 4, 5 o'clock in the morning, that I feel that if it's a decision that I'm making, that I can defend it. And so we're going to get into a lot of different things today. So I'm going to share this. I'm looking forward to having some questions with Pastor Monica during the city council. One of the items that came up was um, it was about medical debt. Medical debt, how communities have erased. You can do a simple Google search and you will find out information actually on it. And so I want to talk about, I'm going to talk about that and talk about how this has already helped our community. Not just in some of the questions were help the Black community. Well, this has already helped the Black community. Grace Emmanuel, about as it's a Black church. They have already helped to erase debt. Church of the Nazarene, they have erased debt. And so having this come to the city, I'm used to this type of stuff. Just like, hey, I supported RX Kids, and there was a buy-in. You have to show that you invested in something for you to get the leverage dollars. That's just how it goes. That's just how it goes. So I'm going to share some of the information that during my one question I asked, which was how does it affect Flint? And were there numbers factored in because of the water crisis? So there's like an estimate of how many people were affected by the water crisis because of the lead poisoning, PFAS, and other contaminants that were in the water. The water was not treated. And this year in April, we celebrated and I'm not going to say celebrated, there was a 10-year mark that the water crisis in the service lines still aren't fixed. Some of the questions are, what is the quality of the water? What is it testing? And I'm going to get into that because it's posted on the city's website. And you can also go to Eagle. You can also go to Eagle to find out what it is. And so I'm going to give you the facts, simply the facts, not any of the drama, because I don't have time for that. And so we're going to talk about about that. So let's get into what time are we at? And I told her. So I think it's Mickey. I need to share this out still. So if you can, I don't know, is she in the chat? Because I figured we would need about 15 minutes. Is she in the chat already, or
Sure.
Pastor Monica? I used to call him Pastor Monica, but she's a reverend. So she's actually a reverend. So and I've been talking with Senator or Antoinette, and this is a program which there are benefits to it. So um, all of the people that are in here, Miss Ruth, Sister Taliba, Monica Souther, good morning, Winters, no name. Um, so this is, this week was interesting. It was interesting. So we're gonna start off with when she is. I told her about 10:15 because I figured if we could scroll down. Good morning, Reed Johnson. Reed Johnson sends me every morning a very thoughtful good morning, and I appreciate that. I truly do, and I want to thank you for that. Jazz Melly, Marcus Felder. Let me put this. So I want to make sure we get into. Oh, she didn't send me something else. She's going to be there. So I want to put up, if we can put up Mickey before because we've got about 5 minutes. So this program, it was actually a resolution which was on here. It was a resolution that was on our agenda this week, and they were asking 50,000, and they were going to help to wipe away debt for people. And so some of the questions were, um, does it wipe away debt? Uh, is it reported on your credit? It's not supposed to, but it often is. Is it included in your debt ratio? Uh, can they garnish you for medical debt? Absolutely. They can and they do. Absolutely. So, how important is this when we talk about helping our community? So, all of these questions are valid questions. And so, we're going to talk about all of those. So, I want to put up I want to play. Mickey, can you put up? Um, there is an article. Uh, Actually, no, it's a video about some of the places that this has already helped. And so, one thing when we say, we want to help Black people. Well, I'm a Black woman, of course, and I have Black children. But this is, um, yeah, we can put, yeah, no, the first one, with the now. I don't know if that video is gonna play. I had a problem. So, is it up yet? No. Okay. I think. Wait a minute. I think we go back down. What was it? Okay. Maybe down to the like the gold brown color picture. Okay. Um,
That's just a picture.
okay. That's just okay. So the video isn't gonna pull up. So Grace Emmanuel, which is a church that is in the city of Flint, established in 1966, and it is a Black church, took advantage of this program. Questions came into question about this company. Is this company a good company? Is this company, what is their credit rating? Are they just coming to get 50,000 to give you up to 32 million? And so we're going to get into that. So the video is not there. Okay. So I'm going to read this part. So this is what Gracie May says it says, through its Grace on Display campaign, church members were encouraged to combine their donations with RIP Medical, a charitable partner to reduce a significant portion of the county's unpaid medical debt. We truly appreciate the support of our members and friends by contributing greatly to the benefit of uninsured and underinsured of Genesee County. By partnering with RIP Medical, GEBC's donation has been multiplied in a significant way to help alleviate medical debt for many uninsured in our communities, said Dr. Turner. Grace on Display is an outpouring of the work and sacrifices we make every day as Christians to help our neighbors, especially during their time of greatest need. It's truly a powerful demonstration of what we can do when we all work together. RP's medical uses donors funds donors' funds to eliminate medical debt from the uninsured and underinsured. And these are two very real issues. Everyone doesn't apply for Medicaid. They don't. Some people make too much money, and it is an issue. Um, so so I'm gonna get into so hold on. I want to go back into because I'm gonna address Mark Hutchinson because there was a lot of garbage that was going around. So Mark Hutchinson says your vote now has meaning. The issue is not the medical debt resolution. The issue is that you needed your vote and you gave it for nothing. Did you did you get your hearing on? Did you get your hearing on what? I'm not here to debate and go back and forth because one thing I'm not delusional about is certain people in that council are not going to change. So the call went out that I'm with them. I'm here to do what's right for the city. It's not a with them. I mean, I don't have any delusion that Candace and Liddell and I are going to get along. It's not going to happen. And you can go back and look at my voting record. You look at my voting record. So when we talk about, there's a whole agenda, and we're going to go through the agenda. So I'm not going to, what I did state, and I want to be very clear when it was said, well, she didn't understand the assignment. Yeah, I did. What I stated was, I will not be giving them their vote to put someone on that council to put me back in a personal hell or my colleagues. And I'm not. That means appointing someone to that seat, which is now in court. I don't know when the court date is going to be. Don't have a clue when it's going to be, but it's going to happen. Not going to do that. I don't even know how many people the deadline closed yesterday. And when it closed yesterday, we weren't told how many people applied. That has not happened yet. And so what I'm going to do is wait. More than likely that I think it's going to be geared to if they win the case, and I'm going to get into that later because there's certain ramifications. You know, precinct 15 is now an issue. That's an issue. The ballots weren't sent out to a certain portion of those. That has been sent to the state. They were told that the state wasn't going to certify the race. So these are real issues. So I am not going to put a person in there that's going to continue to not listen to the rest of the council. I'm not going to do that. Not going to. And that's not going to happen. But I want people who give false and erroneous information to understand, you know, what my decisions are and what they're based on. More than likely, in what they're trying to move this to is to have an election in May of next year. So if the court allows them to take the case further, then what's going to happen if it's voted in favor of those who are in the third ward, then what will happen is the election will continue to go on. And what they will do is allow write-ins, which I'm hoping that's what they do. I don't want to, as I stated before, I don't like appointing people to the seats. I've been consistent with that. I like to have people who are elected. I've said that when we had to do that for the first ward. I said that for the seventh ward. So I am consistent with that. Now, do we stop all the business if we have to go to May? You don't. I mean, there are some things that people cannot wait on. That's just simple as that. This is the business of the city. We also have to have the money allocated by December, period. That's just what it is. So we're gonna go through that whole agenda, and it got heated when he got to talking about that extra money that they wanted to go. I call it vacation money because I feel that's what it is, and they didn't get that, and they were upset. I believe in professional training. I absolutely do believe in it, but when our colleagues go and they do not come back to give something to give, then it is a problem. One just asks, why wouldn't anyone talk about this in a council meeting? Well, we don't have 5 votes. And I want to state this. I never voted on them goofy rules. Never cared for them. I believe in debate that we should be able to talk freely, move things along. That's just me. But anyways, we're going to bring in Pastor Monica. If can we bring her in, Mickey?
She ain't on the screen.
She ain't on the screen. She just texted me. Working on mic and camera. Okay. Um, and she has a newborn baby that's 6 months old. So we can go through some of the questions until she is ready. So Eunice put saved by the Reverend. Yeah, I'm not doing people flippant remarks today. Not doing it. Um, Eunice Jackson, like roofs, how long have they been waiting on roofs? A very long time. We were able to move the 850,000, which will go to roofs. Not going to be enough. But let me tell you this: if y'all really want to help, get me some help. Okay. So if you want roofs and ARPA money, and we don't even really know how much is in ARPA because those categories change until we get 5 votes. 5 votes, that part's not going to change. It's just not. I'm not supporting their trips. I didn't support move the nation outside, and my reasoning for that. Um, and I'm gonna get into that later. There's a lot of stuff, and what you saw was them. Y'all don't really, you can't hear everything that they say. That entire meeting, Candace talked underneath her breath. So for over an hour, she leered at me, hissed at me. It was really ridiculous. What I was working on at the time was 2 different projects, and I was going to leave. I needed to leave early, and I was able to get someone to take care of what I needed to take care of. And so, what I will get up out my seat to do every time my mother calls and my children call, I'm gonna do what I have to do. And then actually that night my attorney was calling because there were some things I needed to get him also because my case will be going to the Michigan State of Appeals. It will. So let's go down some of the questions while is she in there now?
Mhm.
Okay, let's go on to Pastor Monica.
She on mute.
Hello, hello. We're just having some tech issues.
That's
I told you.
that's common. That is common. How are you this morning? And thank
I
you for
am
your
doing good. How are you?
I am doing well. So there's been a lot of questions, and you and I have talked about them, about this program, what this program can do, what this program is about. So
Yeah.
one thing we don't generally have, and I did state at the time that what I would do is give you and Senator Annick a call back because both of you were accessible, to continue some dialogue because I still did have some questions. And so when I had we've had great dialogue, and there were
Yeah.
questions. One question was, um, how does this affect when we talk about the medical debt, um, for people who are affected by the Flint water crisis? We know
Hmm.
that between 99,000 and 140,000 people were affected, and those were the people who were living in the city and those who came into the city to work um, daily because of their job and were exposed. Those were people who were exposed to the water. There is no direct, no one number, so it gives a range. And I'm going to put that up later. But if you can tell me about the program.
Oh, absolutely. Thank you. And I am so excited that our community is having a really good public discussion about this. This is the first time we've really talked about the impact of our healthcare system and medical debt. And the Flint community, just like you said, Councilwoman Burns, we have been through so much. The Flint water crisis and then COVID-19. And I thought your question about, the Flint water crisis and its impact on our community was absolutely excellent because there is no way that undue medical debts algorithms. So, they've been doing this a very long time. They're experts in purchasing medical debt portfolios and eliminating it. It's their mission, it's what they do. They know how to do it. They have no algorithms that can account for the kind of crises and, public health issues that a community like Flint has experienced. And I know that, their algorithms show that we're anywhere between kind of that 10,000 range, 13,000, folks impacted. by medical debt estimated, 32 million, right? That folks are carrying. But I agree with you. I think that the algorithms could be low. And that's even more concerning to me, right? Not that it's going to ask the city to pay any more money. The resolution is for 50,000, and undue medical debt is very committed to leveraging those state dollars and other dollars that they may have. If we get down the road and you know what, we have really good participation from our community, if medical providers step up, we find exactly what you wondered about. Is there more debt here than what we thought? Because debt held during the water crisis, what are we, 10 years out now?
10 years to
The
this
that
year's the 10-year
Yeah,
mark. Yeah.
it's incredible. Those are really old debts, and families are still weighed down and burdened by the Flint water crisis. If they're weighed down by that, man, they're struggling to make ends meet on everything right now. And so if we can relieve those debts, it's going to be hope. It's going to be fresh air to folks. People are going to, it's like swimming underwater, and getting this debt off of the backs of our people is going to be like coming up for fresh air.
Yeah, and so this program has helped other churches before, and actually not just in the state of Michigan,
Mhm.
even when you do a good Google search. So one of the questions was, what is this company's, this nonprofit, their credit rating? And you actually sent me the information.
Yeah.
So, Mickey, I don't know if you can take me off the screen to put her up, or can you put up what it is? A picture?
She would have to send it, yeah. But,
No, it's already on mine.
it's on your, wasn't it?
Yeah, it's on mine.
Let me go find it.
And I think that's a great
It's a
question
collage of
too,
3 pictures. Okay.
because it's a big deal. Like who
Yeah,
we,
put
right,
that
in the community
right up
do
there.
business with matters,
Okay.
right? The reputation
Absolutely.
of the company, how they do work, and how we vet.
Collage. Right.
Yeah, I'm hoping, yeah, if we can get that.
If there's hold on just a second, Reverend Monica.
Yeah.
There's 3. The company's names, I'm under debt. And then so there's 3 that are in that collage. So do the next one. Now, maybe you need to go the other way. See, there's 3 that are there where you see the stars.
Hold on. That's what I was asking. You got to come out and tap on. That's what I was asking.
Okay. Okay.
That one.
Yep.
Perfect.
Okay. So I'm sorry. I want to make sure he had the
Yeah, I think it's the Guide Star.
Yep. So this is their credit rating, and we're not talking about a company.
Yeah, there we go.
Yeah. So what is their credit rating? What is their performance rate? So can she see it on hers?
Yeah, I can.
Okay. So the credit rating is 4 stars, which is great. They have a 97. It says this charity score is 97% earning, which is a 4-star rating. So that's an A rating. That's an A rating.
Yeah,
And
it's
so
very good.
it's very good. It's very good. And so when we talk about, people were concerned about, is this another company that's just here to get $50,000? And I hate to say, they have given council members just 50,000. We haven't seen it. So that was my concern.
Yeah.
And what is their credit rating?
Well, and it's a really good concern too, because this is an outside company, right? So a lot of our other work has been local organizations that we know people, right? You have connections to people. We know the executive director. We've had residents utilize them before, and this is somewhat unique because this is an outside company, and I think all the more that we do the proper vetting, right? This company is a national 501c3. It's what they do. And I have learned so much along the way working with them about debt, specifically medical debt. I knew nothing about buying a portfolio. Like, what does that mean? It's like out there. And the idea that you can pay, for every dollar invested, there's $100 in return, it's kind of mind boggling. And it's also very disconcerting that we can negotiate down that far. These are debts burdening people. And what do you mean we can pay $1 and get $100? I mean, it almost sounds too good to be true. The reality is this is that world, right? So the world of purchasing medical debt, this is how it works. It costs, so let's take a hospital, for example, because they're the largest, they have the most debt, right? They're huge facilities. We have to utilize hospitals. And these hospitals, it costs them money to follow each and every debt, to have it on their books. They have to audit every year. They have to have a staff member literally track this. And then think about, because all of us have received medical bills, I'm sure. Think about all the paper that they spend printing that, sending it out. And what's the cost of a stamp these days? Way too high.
73 cents.
Yeah. And so
73 cents.
exactly. So every single bill that they send out costs them money to track. And what do most of us do when we get them? If we kind of put them in the trash bin, they stack up. And so it costs the medical providers a lot of money to track these debts. And the debts we're looking to relieve are families who can't afford the debt to begin with, So these hospitals are tracking debts that are never going to get paid, because guess what? Water heaters break, other bills come up, things happen. If you don't pay your consumer's bill, what happens? You got no lights tomorrow.
They cut your power off.
Exactly.
You better make some arrangements.
That's right. So, if I was to prioritize a bill, right, I'm going to pay my consumers, make sure my lights are on. The medical bills, some are the ones we set aside. And the reality is they just stack up. And before you know it, we're in over our heads. I think that's a reality of a lot of families. And if the hospitals have already exhausted their other options to move this debt. What this program does is it gives us another mechanism, another opportunity to remove that debt for families. And the hospitals are willing to do it for peanuts. I mean, cents on the dollar, because it costs them so much as well. And they want to do good for the community, right? They're about serving patients in healthcare, not about keeping track of all this stuff. This is an awesome opportunity.
So here's a question and a concern, because we know Flint is really lucky to have Hurley, which is a city hospital.
Yeah.
So Hurley, anyone that goes, you're going to be seen. That's just what it is.
Mm-hmm.
It's a city hospital. So my concern and my question was, and I think I talked about it with Senator Ananek. I think I did. And I talked about it with you. So how much is their debt from unresolved? Because if you're coming in, generally people are coming in through emergency. At that point, they've waited so long to where it's critical.
Mm-hmm.
They're going to be receiving services that they didn't have a primary care physician.
Right.
So the rate is going to be higher. They may have to have an extended stay at the hospital, depending what it is, because we live in a city that's 50% Black, African American, and we have a very high poverty rate.
Yep.
So with Hurley being a city, and it is a city-owned hospital, and some people don't know that. So that if you go there, you will be seen, whether you have insurance or you don't. You will be seen at Hurley. So my question was, how much debt does Hurley accumulate in 1 year? How much debt do they have? And I want to do over the 10 years, because my question that I posed during city council was about the water crisis. What was that effect on it? Even if it's old debt, but these problems don't go away, and people have to understand that if you have cancer, hair loss, rashes, or whatever because of the water crisis, you're going to have those issues your entire life. Generally, unless you're cured for cancer, but you still have to go back to make sure it hasn't come back if it's went into remission. And so people are going to have lifelong health issues. That's just a fact. And so my question was, the 1 year, and 1 year, how much debt does Hurley normally get for medical debt, unpaid bills? Then what is in 5 years, and then the 10 years, because the last 10 years, because it'll give me a marker as to see how much debt and how did the water crisis affect our health, because you still hear people saying,
Yeah.
you know, we have cancer cluster study happening.
Yeah.
People have blood cancer, the different type of blood. You have multiple melanoma. You've got hair loss. There's so many things that this affects. It affects women in the water crisis affected women with reproducing. So these are all things that people end up um, in the hospital for. It increased for miscarriages. People drank the water for, I believe,
Mhm.
18 months and did not know. They were saying, "Oh no, that brown water is good for you."
Right.
And so the problems don't go away because the water, all our service lines have not been fixed. So people are still going to have, they're incurring
Yeah.
debt still. And I'm
Exactly.
looking at a 10-year span, because I really want to look at the numbers and to track, or to try to see how did this affect the health of Flint residents. So,
Yeah. Oh, absolutely. And you're so right, Councilwoman Burns. These problems don't go away. As a matter of fact, they kind of just snowball, right? It gets worse and worse and worse. And that's unfortunately kind of what happens when health issues come up, right? There's always follow up care, there's always more doctors, more tests, more things. Um, and the reality is, the older we get, the more this is kind of part of life, right?
mhm.
And if anyone is, a person caring for elderly parents, those realities very well. I do think Senator Ananick
I,
is
I
certainly.
definitely, I definitely
Yeah.
understand, because
Oh,
my mother has had 4 strokes. My
oh, wow.
mother has had cancer, and so when I get out my seat, it's because my mother is calling, and that last
Would
meeting,
you?
I needed to leave to go. Her caregiver had not arrived, and so I
Oh,
was going to have to leave, but I ended up being able to work some things out. So absolutely, absolutely,
exactly, exactly. And we care about our parents, I mean,
absolutely.
they have raised us up, and our, we take care of them, and it matters. You ask a great question. I think Senator Ananick is a better one to have answers with regards to maybe specifics around Hurley. But I think
Hmm.
that the what you're talking about, which is Hurley receives a lot of patients, and Hurley receives probably the most patients who struggle financially. And as the city owned hospital, they are obligated to give care. Now, I know that they have a foundation and they work very hard at compassionate care, which is, they raise money on the side to help provide care for people who cannot afford it, right? For a whole
Hmm.
host of reasons. That's why this program, I think, is so important, not just for Flint residents, but I think it's important for Hurley Medical Center too,
Hmm.
because of the 3 hospitals in our county, they are more likely to have more debt because of the population that they serve, just like what you shared. And if this program can help them move that debt, it's going to cut down on costs for them, which is cost savings for us, right, as a community, which then will allow them to say, use their compassionate care dollars. They're going to go further, right? Because they're
Hmm.
not waiting on, they're not tied up. Again,
Hmm.
tracking all of this, the bills, it going out, the stamps, all of those things. And so this has to me, it's like when you drop a pebble in the water and you see the ripples. What
Hmm.
this is the kind of program where we're going to relieve debt, and the impact of that is going to be lasting for time to come. You mentioned, delay of care, right? And
Hmm.
this
You
happens.
see it all the time.
Yes. Oh,
You see it all
absolutely.
the time.
My dad, this is, I also, my dad has some terminal illness. And so, I always say to him, Dad, terminal illness just means that what you have isn't reversible.
Mhm.
The goal is you live life, right? You want everything to do, you want to enjoy life. Yes, it means a lot of trips to the doctors, and we're trying medications and this and that. But I remember one time when he said to me, he needed to go to the doctor, and he said, well, I can't go to that doctor because I owe them money. And I think a lot of families experience that. People don't feel like they can go and see their physician because they owe money, and they feel like as soon as I show up, I have to pay some dollars, and they don't have it. My dad didn't have it. He didn't have the money to pay. And so I've seen this with him. He doesn't go to the doctor, right? And so something that might have been small, that he might have been able to get a medication for, or a medication adjustment, or he took care of, it becomes a big thing. And next thing
Mhm.
you know, dad's in the ER. And now we're, like you said, a hospital stay. Now we're in the bigger issues. So when we relieve this debt from families, that weight that's lifted off is going to allow people to go back to their physicians. It's going to allow us to catch medical issues earlier than later. That is cost savings down the road for families.
Okay, so and I want to address, and I agree with that.
Yeah.
And so I want to get, because um, there's certain issues, certain topics. This is about medical debt, and so
Right.
there's a chat. I don't know if you can see it. And so in the chat,
Okay.
if we're talking about homelessness, that's a separate
Mhm.
issue. This is medical debt. We're not talking about homelessness, which I have talked about and advocated for and will continue to. So we're not talking about it. This is specifically medical debt. And this is a conversation we're having. And for those who don't understand how council works, committee is where we do the work. We do the
Yep.
work, we talk about it, we ask our questions, um, we figure it out. And that is what we are supposed to do. And so one of the issues people are
Mhm.
saying, well, just let it sit on your credit.
Oh,
But let me tell you
okay.
what the credit is. Those uh,
Mhm.
when you have medical debt, they have the right to garnish your paycheck. Your paycheck can and will and has been for many people garnished. So those are funds that you don't get. The fact that you
Mhm.
cannot put on your credit report, or it's not supposed to be effective. You can't get all medical debt removed. You can't.
Right.
Some agencies just put it on. All of them don't follow the rules. They just don't. And so when we talk about this, there's some clear things, because I think people in Flint, they're wrapped up in my vote, and that I'm voting with, what they consider to be the other people. I'm
Mhm.
looking at this is medical debt. This is a process now. We're gathering information. We're having a public conversation and dialogue. This is what we're having. What can be done? How do we move it along? Homelessness is the issue. I'm also concerned about
Yeah.
10 children that have been shot in the city of Flint. Those are
Yeah.
Black. But right now, this is medical debt. This is medical debt. And so not interfering, and people are saying in the chat, well, it's your vote. Right now, it's medical debt. Once Reverend Monica gets, off of here to share information, we'll get into that. So
And they're all connected, right? I mean, we can't separate people's financial situation from the experience of homelessness.
right,
Or from the experience. Yeah, I mean, credit scores are interesting because not not a lot of medical debt in reality goes to the credit bureaus. Some does. I mean, I did meet a resident who said, yeah, I have collectors calling me, right, about medical debt. A lot of times medical debt doesn't go, to there, but to your point, people are still paying on it, right? It's still a debt.
right.
It's still there, and
And
it still has, yeah, it has its impact, because if I have to pay that bill, then it might mean that I don't pay my medication that month, right? Or I don't get my refill. Or
or
maybe
your
it
or
means
your check is reduced if you're being
absolutely.
garnished. So if you've taken
Exactly.
25% of your check to pay for a medical bill, then you have got a problem. Then you can't
And
pay your consumers, you can't pay your car payment, you can't buy your groceries, you
there you
can't
go.
do a lot of different things. So although, and it's
Exactly.
not just people, I don't want people to think it's just because it's sitting on your credit report. They have the right to garnish you, take your wages.
And you
So if you
still
go
owe it.
to get, absolutely, if you go
Yeah.
to get a home, if you go to get a car, if you go to get a cell phone, when you have to
Right.
apply for their program, any place that they're requiring you, or you want to get a home equity line, whatever it is, You know, that when they ask you for, we need to see, can you pay for it, say this new car? You
Right.
require to show your pay stub.
Yep.
Your pay stub, and then if it's a mortgage or whatever, your mortgage may give 2 years, some may up to 5 years. They want to make sure that you can sustain the bill that you're incurring. And your pay stubs, your pay
Mhm.
is required. Period.
Yeah. And you know what?
They will, you
And
have
you
to
know,
show that.
absolutely, Councilwoman Burns. And you know what the sad thing is about medical debt? And this is why, for me, it's different than other kinds of debt, right? Different than a
Mhm.
mortgage, different than a car loan. Nobody wakes up and says, "Give me cancer today." Nobody gets in a car and thinks, "I'm going to get in a car accident today."
Mhm.
Nobody who sends their child out to play, although we know our kids, I was a kid, I climbed trees. Anyone ever had a kid fall out of a tree? you know, I mean, people incur medical debt because they have to, right? Don't
Mhm.
ask me when I need a ventilator, can you afford this? Right? We just do it. We save people's lives. And
Right.
that's what makes it different than car loans, education loans, other types of. We have to because nobody asks to have to go to the hospital. Just last week, this is part of my delay on this project too. Last Thursday, actually, my husband came down with appendicitis. He woke up. He's like, I just got pain. I said, why don't you go to urgent care? Someone can, at least they can, press on your belly. And they didn't rule out appendicitis. They said, hey, if it gets worse or you get more symptoms, go to this ER, which I just learned about, by the way. I think it's a great resource. If you can, get out there to the ER on Owen Road because it's a standalone ER. The way it works is they examine you, they have CT scans, they have diagnostics, they have blood work. If you need to go to one of the other three hospitals, they transfer you and you skip that whole ER visit in those hospitals. It's pretty cool. And as you know, we have a 6 month old. I was not enthused about going to a hospital waiting room with my 6 month old. you know, I mean, the whole family's vulnerable, but you just go in and you're like, oh, who's sick with this, that, or the other, right? What flu, colds, RSV. And so we went there. They did the diagnostic. Sure enough, appendicitis, transferred him to another hospital. We skipped the lines, and he had emergency surgery Friday morning. We don't have those bills yet, but
So, quick question: what
yeah.
are the eligibility requirements
Oh, for the program?
for the program?
Absolutely. And I did send a screenshot of this too. So this program is going to cover up to 400% of the poverty level, which, and if you have that, I'll also pull mine up so I can verbally share. So for a household of one, the poverty guideline at 400%, right? This is federal guidelines, is $60,240.
Hmm.
So for a household of one, you have to make that amount of money, or that amount of money is eligible. If you're up above that, not eligible. For a family of four, let's say that, $124,800 is the eligibility for this. I think
Okay.
for a community like ours, that's going to capture a lot of people. And this is the first program I think that we've seen, or certainly that I've seen, and I look around the country a lot for different things, where we've really expanded this to the middle class, right?
Okay.
So it's definitely going to capture the folks who are really, really struggling.
So
But
how would people apply? Because
oh,
do they do it how do they apply? How do,
yeah,
if you have someone who um, has 30,000 or 50,000 in medical debt, or 5,000, how will they apply? Because we're just now talking about this. I know it was for 30 minutes. We had a special order for you to
yeah,
talk, which is not, and it went over, and that still
right.
was not enough time. Um,
Yeah. This is
it,
such an important project.
right.
It deserves continued dialogue and discussion in the community. Um, so that's the eligibility. And the way it works is undue medical debt will use the dollars contributed by the state of Michigan and the city. They will do contracts with medical providers, right? They start with hospitals because that's where the bulk of the debt is. They'll start with hospitals, but this program is open to other types of providers as well. So, hey, if your physician, talk to your physician about it. That's something I think we as a community can do, is to tell your physician about this program and encourage them to be a part of it, right? So any physician can be a part of this program and sell debt that's on their books. So Undo works with the providers, starting with hospitals, but other types of providers. They provide an analysis of their portfolios. They say, here, here's what we'll pay for these really old debts, here's what we'll pay for the newer debts. And basically the provider gets to say, yes, I'm willing to sell this. So on one hand, I want to be really clear with the public. This is not a program where I go down to City Hall and sign up. And I know that's going to be hard to hear. On the other hand, how many of us like government bureaucracy and more paperwork? So when the debt portfolio is purchased, whatever debt is in there because the provider is willing to sell, that's the debt that's relieved. And Undo Medical Debt will send out letters to those folks. So it's kind of, you don't
And what
know.
does those letters state? I mean, are we saying if I have a bill at Hurley
Yeah.
Hospital, I have to go through emergency, and services I owe, say $4,500, and I couldn't pay for it? What happens to? So you saying sell it? The question: what do you mean sell the debt? Or you're buying the debt?
Right. So Undo Medical Debt buys the debt from the hospital.
Mhm.
So therefore it's done, it's over, it's free and clear. And then Undo will send a letter
Free
out
and
and
clear for
they'll,
the patient.
yes, yes,
Okay.
yes, absolutely. Free and clear for the patient, right? Gone. And Undo will work with the city because this will be the moment in time. There's a lot more media presence, a lot more, um, we want the public to know, hey, these letters are coming so that it's real. I mean, if I got a letter in the mail that says blah, 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 I probably honestly wouldn't believe it in the beginning.
Now this
And
program, I'm sorry, go
yeah,
ahead, because
no, go ahead.
there was one about in California, and I think I do have the video for
Okay.
that one. And people were just getting letters in the mail. You didn't
Yeah,
have to apply. They were getting it.
exactly.
You didn't even have to apply. They were sending out that your debt was removed,
Yes.
and they removed, and I've got it that I'll be able to show it.
Oh,
How
cool.
much that you it was ABC 7 in LA that they did this program. There was one of the questions was, where has this program been? It was
Yeah,
California, Texas. It is you stated a national
yeah,
program. Okay. And so um one of the questions, Winters Hall had a question. And
yeah.
so can you go back down, Mickey, what her question was?
She said,
I'll read it.
okay.
Thank you. It says, okay, so we know this is going to pass. It is, whether my vote is in it or not, it's going to
I
pass.
hope it does. I think this
Yeah.
is good for our
Whether
community.
I'm the sixth vote or not, because it has 5 votes. 6 people voted to move it along, and I do believe it will probably end up passing. I do still have some more questions about the program, because like I said, committee is where we do the work. I've got some
That's right.
questions. She says, okay, this is going to pass. This has been established, but the city hospital where you go if you have no insurance for the 100th time, did Hurley agree to work with you? Is Hurley Hospital working with you?
That's awesome.
Are you at that point where Hurley, McLaren, and well, Genesis is an influent,
Right,
but
but they do serve Flint patients.
right, right.
Exactly. I think that's an awesome question, and you know what? We told Undo, "Hey, you're gonna be asked this." What I can say personally, because I sat in the room, is we had a Zoom meeting, that I was in with Undo Medical Debt in and our hospitals. We had
Mhm.
hospital CFOs, okay, which is the chief financial people, right? The people who do this. And we had a couple medical providers, so individual physicians who attended. They listened to the presentation, they asked their questions. There is deep interest in this. And so I do think our hospitals are going to be on board with this project. I can also share, and if Senator Anna Nick was here, he would say the same thing. This project went through the board of the Greater Flint Health Coalition. And if you look at who's on the board of the Greater Flint Health Coalition, it's hospital CEOs. It's hospital, it's these high up hospital people. And the board approved this measure, which gives Senator Anna Nick the leeway, right, to address city council, for example, as part of the presentation. Because as the executive director and his board signing on to this, they're saying yes to this. This is important. We think the Greater Flint Health Coalition should work on this. And that's why Senator Anna Nick has been involved. And they are a very important partner in this, because to the point of, people don't have insurance for a whole host of reasons. Sometimes the insurance just lapse and you're stuck without it and something happens. Sometimes you don't know how to get insurance. So what happens is that people end up with these really high bills. And what we want to do as a community is, when we're seeing these debt relief, if someone doesn't have insurance, we want to help them get insurance, because that's most important for their life moving forward, right? We want to understand how debt works in our community, because beyond relieving it, there's some more policy issues we need to handle, but we're not going to know how to do that until we know what the problems are. We know that one of the high reasons for high debt is high deductible insurance plans. I mean, think about it. If I have a $3,000 deductible, right? So I'm paying my insurance every month out of my paycheck. And then my husband gets appendicitis and we end up at the ER. He has emergency surgery. I have to have $3,000 sitting on the side already, right? Like a savings account. People don't have this money. So that's how we incur these debts. I want to get to a point after we relieve these debts. We want to get to more root cause. We want to get to, why are our medical costs so dang high to begin with? Why do families continue to get in debt? What can we do to interject that?
Okay. And so, and these are some of the questions people are having. And I will say, on these podcasts, people tend to, they follow like the same ones. So Christine, she says it makes no sense, won't fix the water, but want money out of the sickness medical assistance help with any way. And so go to another one. So,
well, we need our pipes fixed, that's for sure. So, I mean, I'm not opposed to any of those other projects, on all those.
Absolutely. And so, and but I wanted to stick specifically to your program, because there were a lot of questions that I did have. Yeah. And I did not, like, you were set for 30 minutes. Every councilman allowed that to go over. You were well over 30
appreciate
minutes.
It. Yeah.
Yeah. And because it is something, we have multiple issues in the city of Flint, not just one. And so with having multiple issues in the city, I think we can walk and chew bubblegum at the same time. And so it is not stating, this is specifically, I want to hear your input. I didn't, and I want to have an open dialogue with you, as opposed to me having the conversations with you and Senator Anna Nick on the phone, so that people could hear what's going on.
Absolutely. We want the public to hear about it. I've been out. By the way, anyone has neighborhood association groups, other groups, church groups, I'm more than happy to be connected to come talk about it. I want to listen to the public too and hear where are our questions, where are our concerns, where are our hiccups, because this will help us as a community continue to move forward, not only relieve medical debt, but like I said, let's address some of these other issues too. If we can relieve medical debt, then we can start working on how that debt impacts these other areas of our life.
So one of the questions in here, and it's I'm gonna take a generalization, is people are asking, well, what about advocating? What else do you advocate for? I know this is medical debt, But
Sure.
in the chat, they're concerned about high water bills.
Yep.
They're concerned about roofs. And they're saying, why not advocate for fixing the pipes? Well, the state is taking over the fixing the pipes now.
Yeah, that's a whole
Yeah, that's
yeah,
a whole nother, yeah,
that's
the
we
Flint,
could do a
yeah,
whole podcast on
the
that.
state, yeah, the state has taken that over. And that's just what it is. We're the state, and they are doing service line replacements. You'll see them doing some in my ward. I've seen them working and doing it because where they're at, I don't know because we
Yeah,
don't have 5 votes with the administrative consent order to where when we did, they voted call for the question, and we had
right.
27. We had 27 issues or 27 projects to state where they were. Sister Talib said, "Open the phone lines." There is no phone lines. We don't have a
Right.
phone line, and
Yeah, it's a hot mess.
yeah. Well, I actually appreciate public opinion and what they have to say. I actually do, but I don't. We don't. I don't have. I don't do the phone lines, and so I do want to hear, and I want to have an open discussion because she is a social worker, and we've got a
Mhm.
few social workers that are on here, and this is what they actually work with every day, and they see people and in a forum. And so, one thing I've seen in Flint is that we often don't have the open dialogue where everyone's on the same forum. And I get what they're saying. Um, there are more pressing issues. I have
Mhm.
advocated, and still, I mean, it doesn't change what I work toward. It does not change. And so they're saying, why is medical debt? But we got to kind of go all the way back, which is not your issue at this time. You're here specifically for um, just for medical debt and this
Right.
program
And it's because
that
it's the opportunity we have.
right.
Yeah,
And
it's
this is the
really
first
more
time
about
that you come to
absolutely.
council this week to speak about it. And
Yes.
so yeah. And so there is a lot of questions that like I say, I want to know the 1 year, the 5 year, the 10 year. I know that people will have more increased illnesses because of
Yeah.
their immune systems were compromised.
Yes.
And so there's a lot of different components and questions that I do have to ask. Um, so
And we will
um,
try to get you, some of that very specific hospital,
right.
information if we can.
Right, and I
Yeah,
have not gotten that yet. I have not received that information yet, and when
correct.
I get it, um, I will definitely share it
Yeah,
when I do get it because those are some questions, and I know some of the questions. Like I said, this is the first discussion
right.
that we've had about this. The first time that you've come, 30 minutes was not long
And
enough.
I hope of
So
many. Like,
yeah,
this is
right.
an ongoing
There's
absolutely.
going to be
Yeah, and I'll be
there's
out
going to be
in the
many more.
community. I appreciate the question too, but like what else do we advocate for? So, just to share a little bit more about myself, because probably a lot of your viewers may have been who is this lady? I am an ordained pastor in the city of Flint. I'm born and raised here in Flint too. I went to Beecher schools and then I graduated out of Davison schools and went off to college and seminary. So I studied, theology and was called back to Flint to work. And my congregation is on the north end of Flint at Salem Lutheran Church. It's right there on ML King between um on Rankin and Taylor Street. So I've been they call me the hood pastor up there. I've been in the community a long time. And during the water crisis, I had actually gone back to school to earn my master's of social work because I found that when I was working in the church and we were doing outreach, that I needed some additional skills to really help people connect with resources in the community. And so I earned my MSW and really honed my chops in advocacy and in program development during the water crisis when we were trying to figure out how
Mhm.
to get water to everyone, right? And churches really stepped up and we were one of those churches and I was involved in a lot of that kind of work. So I've definitely followed the water crisis stuff and the pipe placement, been to court numerous times. Totally agree. And we keep fighting for that. In addition to all of that, I do teach for MSU School of Social Work, and probably in my role today, like why this came up is
Are
that
you a licensed social worker?
I am not a licensed social worker. I'm not a clinician either. I'm what they
Okay.
call a macro social
Okay.
worker. And I find the licensure, this is just my opinion, to be much more clinical. And in my
Okay.
work, I can kind of do everything I need to do without a licensure,
Okay.
to do that because I'm more community based. So I'm
Right.
not clinical. Macro is like community advocacy. And that's not what people think about, I think, when they think of a social worker. So this is kind of this other side of the field. And I also work for Michigan United. And that's what's really brought this work. So when the public is saying, well, what are we advocating for? Michigan United is a statewide organization that has we do a lot of training in advocacy in we have different campaigns. So I used to work on the environmental justice campaign, but we reorganized this last year. So essentially, we're really a statewide coalition that works in areas of environment, immigration, mass incarceration. Right now, we have a big emphasis on public health. Some of you might have run into some of our nurses. We have a nurse team, right? A public health nurse team that's out in Flint. We help with vaccinations and clinics. They do a lot of health literacy, helping people connect with healthcare systems, helping people understand their medications. In Flint, we have a large team, actually, some who are working on some elections related things. We like to listen to the public and kind of organize around issues that the public has and needs. We've certainly been on the radar of all the topics, Councilwoman Burns, that your viewers have put forward: roofs on houses, access to health care, homelessness, veterans issues. We're a diverse staff with a diverse team. We're really interested in working with folks who want to sit down and you know we're very solution driven. We'll reach out to people, learn stuff. So we're listening too. All of these issues to me interconnect.
Hmm.
They really do. It's hard for me to say what is more pressing than another, because what might be pressing to me might not be pressing to my neighbor, or my church member. But we know that we need to work together and take the opportunities when they come to get, to address the issues. Right. So when we know
Okay.
there's an issue and we have an opportunity to do it, let's do it. And then let's work on the next one, you know?
So a lot of people are concerned when they say, and I think that they were offended somewhere when you said, explain when you say the hood pastor. Um,
That's the title the community gave me. So
okay.
it's, I think for me, it's just that um, I'm present, I'm with the people, and it's the title that the community around my congregation, which the congregation is predominantly African American. We're in an African American part of the community. And we have been for a long time. If you're familiar at all with the history of Salem Lutheran Church, we're a 100-year-old congregation, and we were very involved in fair housing in the 80s. We developed Salem Housing, CDC. It's the first CDC the city had ever received. We've been involved in the church has a long history of advocacy and working with the public. So I too at first was taken back by that, and I had to take it as somewhat of an endearing term, and I hope that a public will, um, because it's not something that I ascribed to myself,
So
but
you're
know that I'm ingrained in the community. That's how I take it.
okay. So the community like Big Gretch. So you're saying like they gave the governor Big Gretch, so they gave you this name, and that's what they call you, the hood pastor.
Well, it's not like they walk around saying that. I find it to
Okay.
be enduring to say that the community has accepted me and welcomed me. It's as a woman of mixed race, both white and Hispanic, working in the north end of Flint, and as young as I am too, right? So I've been ordained for
Mhm.
13 years. You can imagine when people come to the church, they're like, who are you? Like, and what are you doing here, right? And that's part of just being in community. And I've worked hard to build trust. I've worked hard to know the neighbors. We've worked hard on community issues. Our church was very involved in addressing a extremely violent liquor store on ML King, right? Because shootings were happening day in and day out. We had 14 shootings in 1 year. And, when people are walking into my church and we're grieving and we're doing vigils, it's kind of like enough is enough. And we were able to leverage the liquor, control commission to address that. And, ultimately, after we did our work and we went through court systems and all of that, there's been 0 shootings at that store. I would have liked to see the store leave, but there's been 0 shootings. I'm happy with that. That's the kind of community work that I mean, the folks. So I apologize. I don't mean anything, derogatory or negative at all.
Right. It's a term that the community has given you, because it is viewed as a microaggression term. And that's why, and I'm looking in the chat, and this is probably a tough show, a tough podcast. I know the work that you do in this community. I know that it comes from what you're saying, and people may give you a name that it is in a core group that you're dealing with. And being politically correct, for me, it's important. I think because in our council chambers are so heated, and we have been called ghetto in our council chambers, and I think a lot of people don't know by our other colleagues. But I appreciate the work that you do, and if the people that you're working with in your neighborhood, and this is a term that said affectionately, I don't want. I want to address their issues, and then also concerns of like some of the names. But it's a name that you're comfortable with, and it's people that you work with daily, to help move the community forward. So
yeah, and to me, it was just a moment of acceptance, in the
okay,
community.
okay. So and people give names, and it's something that you have to be comfortable with. So for me,
But I go by Pastor
I
Monica.
yeah, I always
Yeah,
and I do. I call you Pastor, right?
yeah,
You go
yeah,
back,
yeah.
and I
That's
call
what I
you
go back.
Pastor Monica or Reverend Monica. And
Yeah,
as you stated, it is not a term that it was meant to be disrespectful.
correct.
Okay, so I'm going to move on with this. So anything with closing out with this program, you're bringing this program. Who all are you working with this program?
Yeah, so this program, of course, the Greater Flint Health Coalition, as I indicated, has also, decided that they feel this is an important program. The Greater Flint Health Coalition, some of their staff members are part of the health committee, and we are all part of a larger task force in the community task force on racial and social equity. We started as a COVID-19 task force during COVID, and the idea was the community would come together to try to address why, basically, the impact of COVID. Right, this is when we're all in our house and told to leave our groceries outside, right? Like, I mean, we didn't know what was going on. So the community came together. They created 5 committees, philanthropy, government, health, faith, and it'll come to me. There's another committee. And so we said we need a multi-pronged approach to address COVID. So we worked hard. We had data people. We did some interventions on COVID. You did a lot of education, vaccines when that became available, all those things. But then kind of we're in almost like a post-COVID world, right? I mean, COVID is here, right? And it's here to stay. But COVID's not like the thing that draws us together anymore. So we said, well, what else? Because we know there's a lot of other issues in the community. What else can we do? And so we changed our name to the Task Force on Social and Racial Equity, because the goal of the task force is to eliminate disparities. And we recognize that on both social and racial lines in particular. So I happen to chair the faith subcommittee, which is the largest committee of the team. And we have clergy, we have public health professionals, we have mental health professionals, we have social workers, we have philanthropy sits on that team as well. It's kind of a diverse team. We've kind of built ourselves out to address issues as they kind of come up. And so The faith committee has been a big part of this. We do have an ARPA ad hoc committee just because ARPA is such a important, contribution, and it came out of COVID, right? So we don't have ARPA if we didn't have COVID. So we have that team that's been working on this. I mean, all in all, and I've gone out, we've talked to Hasselbring seniors. I've gone out and talked to others. We've talked to other clergy. There's a couple of congregations in the community that have already worked with undue medical debt to relieve debt in our community. And so, kind of reaching out and connecting with them. So that's kind of how the project came to be. And we've been working on this for like a year,
So here's a question, because
Yeah.
how do we get people, let's say of a demographic, because people feel like their voices aren't heard. I know this is medical debt, but it sounds like you work with a lot. You do work with a lot of different things. You work with
Mhm.
homeless, your water advocacy. How do we get people in? And I think we have a lot of these organizations that people sit on, but we don't
Yeah.
have the people
Like,
get involved that it really impacts and it affects.
how do we
How?
get to grassroots? Yeah.
Absolutely.
Yeah. So,
And it's probably going to take this very uncomfortable conversation that we're having today. How do we get to grassroots so that we can
yeah,
figure it out to really hear what the people want to move Flint in a positive direction?
that's right. And that part, like what you talk about, is really a lot of the work Michigan United tries to
Mhm.
do. We're always willing to
When does
expand.
Michigan United meet? Is it
Well,
once a
I'm
year?
a I'm a, billable 10 hours a week gal. You see all the jobs that I have, right? So I am not the lead staff member for Michigan United. Holly
Mhm.
Wilson is our
Oh, I
lead.
know
And then
Holly.
we just,
Hmm.
so I would connect with Holly. And you can send people, Councilwoman Burns too, Holly. We just hired a new staff. His name is Abel Delgado. He's worked with us in the past, but now we've hired him. They
I know
are
Abe has
organizers.
been an activist
Yeah,
for
Abe.
some years, and
Exactly.
he was running Michael Clack's campaign. He was there for the water crisis. He protested for the water crisis.
Yeah, he really got involved in the water crisis. And then of course we have the nurse team, but that's probably not quite what we're talking about here. So I mean,
Hmm.
Abel and Holly would be great people to connect with because
Okay.
they're organizers. So my role shifted once Michigan United actually unionized as
Hmm.
a group. So my role shifted to become more of like a special projects coordinator because I'm so limited, right, in my time to contribute to this work. But they are full time and they're full time organizers where they go out, they do one on ones. They want to, like you said, build relationships with community. We want to bring forth issues. We train community in advocacy and tactics and using media, all sorts of different skills to try to move issues into a policy place. How do we bring, for example, some of these issues we're talking about to get them on a resolution, right? There's a lot of steps involved. But our staff can help walk community through that, train them in that, because at the end of the day, it's the voice of the public, right? It's the voice of the people. When Michigan United takes on a project and we move forward, you're going to see not just Michigan United staff, but you're going to see people that we've been working with because it was something that motivated the community. And we saw that in the water crisis too, right? I mean, we're
Hmm.
still fighting
And
things.
we're so we got water crisis, a
Yeah,
pandemic. We got General Motors moving out. Flint has
yeah,
got layers of issues.
exactly.
Layers. So
So there's
when
work to
we
be done.
there's a lot. There is a lot. So how do we get so to get they can connect with Holly, and then
Holly,
I'll
yeah, she would be the
okay.
best one just because of her role, and she's like the regional manager. Now, I do want to just share, at least right now, I know we have a lot of pressing issues. Michigan United has a C4 organization, so you're going to see a lot of staff. You're going to see our staff out door knocking. I think they're done with the Flint community. I think they've moved out into the county now, but they
Mhm.
do endorsements and things like that. So the team is kind of really into election mode. So I just want to,
Well,
honor that
elections, there's a
fact.
there's a lot going on with elections, especially here in
That's
Flint.
right.
And
So
yeah, and I'm going to get into that later.
Right. And that's not my area, just so everyone knows, right?
Yeah,
That's
we
not my
got
area.
a lot.
But I'm just want to give that caveat to the community because if like Holly's busy or Abel's busy, there's reasons why it's not because we don't care about the things that
Okay.
our
So
community does because we do.
what would you like to close with? What would you like the community to know about this project? Because, like I say,
Yeah.
I do not have all of my questions answered. I know that you're going to be working on them because there were some serious concerns. I wanted to do a transparent dialogue. Committee is where we do the work, and that's where it's done. So, can you tell me what would you want people to know about this to get behind undue medical debt to support this? What is it that what would you like to say in closing?
No, I appreciate. First of all, I just want to say thank you to your viewers. Thank you, Councilwoman Burns, for having me on. The public discourse, the conversation, the relationship building. This is all so important for how we move Flint forward. This opportunity that's before us is an opportunity. I don't want to see us, not take advantage, of an opportunity. And that doesn't say that there aren't more issues to work on. There are, and we need to come together as a community and organize around those. Again, please reach out to our staff who really do that work and can do that in a more full-time basis. In terms of this program, the weight of $32 million in debt is paralyzing us. It's paralyzing
So
our
is that the
families
amount of debt that is estimated to
to
have?
be eligible. That's just eligible. There's going to be, remember, there's families that are above that threshold who might have debt that's not. So we might have more than 32 million. It's just the amount of debt the undue medical debt has estimated they can get their hands on. I think that's the
Okay,
best way to put it. This is how we get our hands on it. And,
okay.
I know the public's been asking, well, why not just give me some money? I get that. But here's the thing. If I gave, so say I have $1,000, medical bill and I get $100 just to help with whatever it is I need right now, I will only be able to pay $100 on my bill. But if we give that $100 to undo medical debt because they know what they're doing, this is their business, they can turn that $100 and wipe out all my debt. Right. So instead of me making $100 payments every month till I get that $1,000 paid off, I make one payment and I'm done. And now I can move on living my life. Right. And doing what I need to do. So this is the biggest bang for the buck that I think I've seen in terms of projects. And the fact that we're leveraging dollars at the state of Michigan,
How much are you leveraging?
so the whole state allocation is 4.5 million. And Councilwoman Burns, I did email you the actual appropriation. I found it. I was very excited about that. The program so a budget appropriation at the state level means that a particular department of the state has to administer the funds. That is MDHHS, and the appropriation, and I sent it to you,
So you
spells
work
out.
with the Michigan Department of Health and Human Services.
I
Is
don't.
that
The
you don't? Is it
appropriation comes there.
the program does?
Yes, because when the state put it in the budget, when you put a budget together, it has to go to a department, right? There's different departments at the state. MDHHS is
Mhm.
one of them. And it makes sense that I guess a health program would land under them. So they just simply they're going to administer the 4.5 million. And the appropriation flat out says it goes to a national 501c3 nonprofit. And if you look at bullet point 6, I just want to note for the public, that's where Flint comes in. There's a very specific parameter about a city that's like 80 to 82,000 in population, that's within a county that's like 400 and 10 to 420 thousand population. Well, that would be us. So we're written right into that. And the fact, if we don't create this program right now, we won't get the funds because it is a requirement that the local municipality contribute. And $50,000, we actually started this program thinking we were going to have to invest 250,000. And then when Undue Medical Debt worked with the state on our behalf, like they have no we don't even have skin in the game. And these folks were, trying to help us in Flint
Mhm.
get some dollars. And they were talking at the state level. They came back and said, we think we really only need 50,000 in ARPA. And I about fell off my chair
Well,
because,
we have bought into we did 1 million for RX kids,
yeah,
and we were able to leverage 55 million. We gave, I want to say 3.25 to Ashley Capital, and then we gave also for demolition dollars.
yes,
So we have given to leverage funds. I forget the amount that we gave, but then I believe 45 million. What we gave, that was the total amount for demolition. I think it's gone higher now. I think it's up to 48 for demolition for blight abandoned homes, because there weren't funds to demo these homes. And so
exactly.
Flint paid into that. And it also be the same thing that um, they're asking us to buy into. They want, well, that number has changed quite a bit, the food market. So it is common that you have to
Yeah,
vest it. Flint has to receive it. You have to show that you're going to put some of your money in to get the overall benefit. That's just how
that's
it works,
true.
right?
Yeah, that's
Um,
a very good point. And
so yeah,
y'all have done a good job with that.
yeah. I mean, and we're a divided council.
Mhm.
Somebody asked me, how did the Iris Kids program turn out? I never hear about the result. It turned out very well, very very well. And I don't know, Pastor Monica, if you benefit from that, because you have no,
I
your
have a
baby.
little boy.
Yeah. And so I do know parents who have, actually
Yeah,
parents who work, who have benefited from it. I know that
yeah.
I had a young lady, she's 18. She got into some, you know, she was permission. She had a baby. Her aunt is raising her. Both of her parents um, are, well, one is incarcerated, the other one is an alcoholic, and she had a
Mhm.
baby. She was able to benefit from the program. So the program is helping. And it's not
Yeah.
just teens. I will say that uh, for me, I vote to what I feel I can defend and what I feel is right. But I want to stick to your program, because I'll get into how did RX Kids work. I supported
Sure.
it. I also supported the demolition, making sure that we gave to the land bank, and they're all working great. I mean, those are programs that people had to live next door to abandoned homes for years that had become
Mhm.
squatters. They had been caught on fire. They had become havens for crime. And as
Mhm.
we start to get those homes torn down, we're kind of trying to, well, we're behind
Mhm.
the gun, because arsonists will burn up these buildings. And it becomes a hazard to the homes next door to them also. So back to these programs, you have
Yeah.
to become invested in order to get it. It's like your down payment on it. You're making a down payment, you're investing your portion to get, what is it up to? Is it up to 32 million?
In
Or you
relief.
in
Yeah,
relief,
in relief.
but
Yeah, it's not gonna cost that.
4.5 million. Okay.
Right,
Okay.
right. It doesn't cost
Yeah.
us 32,000,000.
Okay.
But
And
yes, for a
that's one of the
fifty
things I wanted to
fifty
make clear.
thousand.
Right. So I wanted to make clear with that, because when we have
Yeah,
a small time to talk about this, your program in um, getting into what will this do for
right.
medical day, because, and I have stated, I've seen the value. I did vote for it, yes, to go to council, and it may go back to committee because there's still a staying committee. I don't know. I've got some more questions. I am not 100% on this, because I do want to know, how does it affect the water crisis, and how do we put into that model the people,
Mhm.
because if we're using 70,000, 80,000, and we're saying 99,000 to 140,000 were affected by the water crisis. That means that we're going to have, I believe, a higher rate of people, as opposed to a lower rate when in the model that has been given. And that is a concern for me. Are our numbers where
Mhm.
they should be, and are they factored in? That
Mhm.
is a concern. So, and
So,
I know that we,
so that I know too what to exactly get you. So is the concern that the cost would go up, or just the concern that there's actually more people impacted than
more
what we
people, yeah,
original projected?
than the original projected, because we
Okay.
know that,
Yeah.
yeah, and there's no exact number of people affected, because we have people who
Yeah.
lived and worked and traveled and visited and, had extended stays of how many. And so
Right.
that is, and I'm looking at the
Yeah.
1 year, 5 year, and then a 10 year. And so, like I say, I do have questions, but
Yeah.
I want to close out, so we can move on. What would you like to close out with? Because I do see value in this
Yeah.
program. I do.
Yeah.
But what would you like to close out? Because I still have questions. What would you like?
And as you know, we are working
And I
to
got a
make
list,
it
right?
so,
I actually have a list of,
you
of
know,
questions.
and even if this passes, we'll probably all still have questions. But that's part of like continuing to work together and working with undue medical debt, because our community is unique. We
Yeah.
really are. And I think the undue medical debt is, who hasn't heard of the water crisis? And so there
Well, they
becomes
think we're fixed here. Honestly,
yeah,
people think the
well, exactly.
water has
People
been
think it's
fixed.
all over. But I think I think undue medical debt has been impressed by our community, and they have advocated on our behalf even when we didn't have skin in the game, and they went after
Mhm.
state dollars on our behalf to help make this possible, in the hopes that they really want to help our community, and we've been with them every step of the way. And my experience of them is that they will continue to have that relationship, and they have a very strong open and transparent way of working. I know that they would work with any council member who has questions, who wants to know more about the process or where they're at, their reporting, all of those things.
You and Senator Ananick have taken my calls, and we've had some good dialogue, and it will continue to go on.
Oh,
As
absolutely.
right, and that is what it's about. Because when we're talking about Flint has got so many layers of issues.
Yep.
It's not just medical debt, and to say we're talking about medical debt does not mean that we're not saying that we're not dealing with home repair,
There you
or
go.
furnaces or hot water heaters, or 10 children who have
Yep.
been shot that were
Yep.
their skin was black. These are black children. It's not dealing with we're not saying not dealing with the poverty rate.
Right.
Right now, this is just one topic, and people
Right.
have to, for me and my thinking, what I have to do is look at each thing. I'm not making a decision today. What I'm having is a conversation with you today, because I have had questions for you, questions with Senator Annanet, and we're talking about it transparently.
Hmm.
Podcast. So
Absolutely. Oh, and we want the public, like I said, I want to hear from the public. I want to know what our hiccups are, what are our concerns. And when I've been out talking about this project, it's not unusual to hear other concerns that impact people's
there's a lot.
lives. Exactly. Um, One thing that just I feel like this particular topic has not really been on our radar. I feel like we've been in such health crises that we've been in, like, we just keep going and going and going,
Yeah.
and it's, I don't know about the rest of you, but my experience in healthcare is you can go to a hospital or a doctor, and sometimes you don't get that bill for like 6 months later. It's kind of like by then you've already forgotten about it,
Yeah.
and it comes, so it doesn't feel as immediate. The health crisis is immediate, right? Because you're in it, but the actual financial impact tends to come later. And so, you know, absolutely. When I've gone out to talk about medical debt, that's when I'm learning about, other issues that families' lives have, because our health and well-being impacts everything. I kind of feel like, if we don't have our health and well-being, what do we have? In a way, I feel like health is just such a gift. I am someone who really believes healthcare is a human right. You shouldn't have to worry about um
I agree with
going,
you.
you shouldn't have to, this shouldn't be the way it is. And we want to do something about that. This is the opportunity before us. It was made possible because the state had kicked in dollars. We're seeing conversation on the federal level about it. Flint has this opportunity, for only $50,000 to make a $32 million impact. and bring relief. And while that maybe happens and continues on, I think these other issues are really important. Our community needs to continue to advocate and come together and, try to really work on these issues. They're big issues. They really are. If they were easy fixes, we would have done them, like,
Yeah.
all together for sure. So I really do hope that the public will, support this. If it's not for yourself, think about your neighbor. If it's not for yourself, think about your aging parent. Any one of us, could end up needing a hospital for whatever reason. Nobody asks to be sick. Nobody asks to get hurt. This is just part of living life. And we want to make sure that Flint residents, that we have the best, healthiest lives possible. This will help us to do that. So I do hope that we'll garner the trust and support of, as many council members as possible, certainly hopefully enough to pass this, so that we can also move on to some of these other pieces too.
Well,
Um,
I think that we have to do these at the same time for me. For myself, I want to deal with homelessness,
right.
that's another issue. I want to do home repair because we can't get anything passed with home repair. And so it is important because, and I've talked about this from my council, see, how do we deal with home repair? So it's not, this is important, but there are some other issues
Mhm.
that supersede this, which is home repair. Saginaw is in its third phase. They
Right.
did furnace repair, then roof repair. And we have not done, only in isolated areas have we done um, some roof repairs. And we have not overall for the city. Now the 850,000 with this lottery part that we're doing, it is not enough out of 94.7 million. But we have a very split council. But I want to thank you. Um, I want to thank you for giving us your time, um, for sharing with us. Um, Explaining. This is a tough platform. Um, Answering the questions, and I still have more questions. Committee is where we do the work, um, and um, that's just what it is. We doing the work, and we're talking to the public. I think this actually for me, I like to bring it to the public so they can see what this is about. Many people don't know who you are, and they don't
Mhm.
know what you do and how long you've worked in this community. And I feel it's important. So I want to thank you for coming on the show this morning, giving us your time. And I don't know if I probably need to email back, the other questions or
Please.
send them to you. I will. And so I appreciate you giving us your time this morning. I know you have a 6-month-old baby. And I hope you enjoy the rest of your Saturday morning.
Thank you so much, Councilwoman Burns, for this opportunity, and thank you to your viewers for the questions, the dialogue. Public discussion is what this is about, and this is how we move our community forward. Appreciate it.
Thank you. So is she off?
Yes, yeah.
So um, Flint does have different layers and issues. We've got a bunch of them. And so this one is just one. When leverage dollars come into the city, we have to, one, we don't have all the time that we used to have with deciding with the ARPA funds. I don't even really know what all we have left in ARPA funds. I don't believe we're actually really going to know um, until we get a fifth vote. A fifth vote. I just don't see that happening because there are some things that I keep a list of, things that need to be changed so that residents aren't being thrown out of Flint City Council chambers, making sure that we can have and apply roofs to furnaces. Now, as it's getting colder at night, the temperature is dropping. We haven't, to my knowledge, put in not one furnace. Saginaw has outpaced us greatly. Um, when we look at what Flint's priorities have been, we now have to, it has not been the same as other communities. And that is because there are 5 votes. So, what I have been committed to is how do I change the makeup of the Flint City Council? How do I change it? Every person that has been running, I did the work. I'm out there helping whatever they need for, if it is to knock doors, if it's to answer questions, um, if it is to campaigning, making sure how do we change some of the seats for the people who are not going to vote in the best interest of the residents. And so as I look on here, I would love for some of the people to join me in, getting some relief, because until we get a fifth vote, it's not going to change. It's not. It's just simply not. And so when we look at the first ward and the third ward, first ward, you've got two people on the ballot, Leon Alameen and you got Carol McIntosh. I'm very vocal. I am supporting Carol McIntosh, period. We need a fifth vote. The third ward, we have got Beverly Biggs Levy and AC Dumas. I wish both of them could have, well, I'll take that back. You got a few more people in there. But I think they said Rich Jones was pulling out, is what I heard. I haven't talked with him. And then Kerry Nelson, I'm not supporting in this. And so what I want to see is help me get some help. Yeah, the criticism is fine. I can handle that, which Mickey stated Tonya Burns has got a thick skin. Absolutely. I'm fine with that. But if you want to change, we need a fifth vote. I would love a sixth vote, actually. And just in case we don't ever have that fifth vote, I would love a sixth one, because everybody don't always vote the same. We don't. I will say the four, which we're split 4 and 4, they are real critical thinkers. And I listen to their dialogue. We do not ever agree all 100% of the time. We simply don't. We just simply, we don't. I never agreed for that contract, what the mayor had with the medical ambulance. I never agreed with that one, because the guy I knew was getting indicted. I didn't agree with that. And he did get indicted and it went out of business. And I did the work where I went and sat at the Genesee County 911 Center to see how our calls were going in. Why were we going without ambulance service for more than 24 hours? And it was happening. Became good friends with the gentleman, Tim Jones, who runs it, and the compliance people. And I go to their meetings out to Grand Blanc at the Grand Blanc Police Department. So there is a lot that's going on. And it's not just because we're talking about undue medical does not mean that we don't talk about furnaces, roofs. It does not. This is a conversation. This is a conversation. Things stay in committee forever. I still have a lot more questions. I have a lot more. And the impact of the people that it affects in our community from the water crisis is going to be real. There's no safe level of lead in the body, period. They were out here doing bone scans on the kids, and now they're saying that the bone scanner, they shouldn't have been doing it because it wasn't what UL listed, and it could later cause cancer. There are some things that have happened because there's water crisis, and it's a lot of moving parts. It's a lot. And so when we prioritize, and I think this is what we have to get down to, how do we prioritize? A lot of this is not going to get done. This is just popped up on our committee, just popped up. And we talk about roofs and homes, and oh, Tonya hasn't advocated. Now, if you don't know my record, I'm gonna help you out with it. I put on the first time we were over at the Dome, and they were fixing our chambers. And I didn't vote for the chambers to be fixed. I felt we should take care of the residents first. My votes have been consistent, and I actually talk about why. The 5 million they declined. They declined the 5 million. They voted down. Why? Because they have 5 votes.
They had 5 votes. They got 4 votes now.
Well,
so
at that,
but you got to make that clear. 4-4 now.
Let me finish. I'm talking about the Dome now.
Okay,
they
ahead.
had 5 at that point. I'm not talking about what they got now. At that point, when I put that up for 5 million, they had 5, and the 5 voted it down. So I am clear on it. Then I put it up again for 16 million. And actually the range, how that 16 million came, because it was an estimate of how many people turned it in that they felt would need home repairs by tabulating those roofs, the estimated amount. And I personally think it would be about between 16 and 20 million. But then supplies, that is changing. They voted it, the five voted it down again. They voted it down again. So as we look at how ARPA is being allocated, they are able to get their five allocated, get it done. And so when you look at, was it four? We have four resolutions that kept getting voted down, and because they didn't have their the five, and they were voted. Who was it? September the 21st or 22nd, where we had not passed one for 200,000. It finally passed. We had not passed for Sarvis Park the second part for 25,000. We had not passed. There were four. Do you remember those four, Mickey?
Mm-mm.
There were four, but those did pass, and they passed. And when it came up, because they had five votes, what it allowed them to do, they had no, there was no, it was called for the question. There was no discussion. The DPW director at that time wanted to make sure, he had asked, because I have always voted no on the administrative consent order, which is almost 200, around about almost 200 pages, and mine has got all kind of notes on it. And so he wanted to give an update on our water infrastructure, and the five of them voted no and did call for the question. He had his team there, Jeanette Best. He also had Scott Dungy, and it's Kenneth, I think it's another Kenneth Miller on here. That's his name, who was a DPW manager. He was there, and we were not able to find out where it's at. Well, I'm not saying we weren't able. I read mine, and so he had 27 projects on where they're at and where they're going with it. And so when we look at the votes, this doesn't mean that we don't still work on it. Oh, this was just a conversation. And I had questions, and I'm gonna ask my questions. That's going to happen. You know, there are the questions that the people who in my ward that I represent, and each vote here is a vote for the city. It is. And so we are supposed to work collectively together, but we know they don't. We absolutely know they do not work collectively. So we are at a 4-4. So somebody put in there, they said, well, Councilman Jarrett voted for it because you did. I vote no, I know. He voted for it because, you know, he saw, I believe he stated the value in it. His vote had nothing to do with my vote. I didn't even talk to him about it. And I had one question. One question. He didn't vote for it because Councilman Jarrett, Councilman Pfeiffer, and Councilwoman Jerry Ricardo, they don't vote for something just because I do. It doesn't happen. It just doesn't happen. Me and Councilwoman Ricardo do not vote all the time together on the same things. We just don't. That's just the way it is. You know, we have to vote on what we are comfortable with, and whatever it is, whatever your reasoning that you come up with. And that's just what it is. But we have not always voted the same. We have not. So I want to go to, because I think that, I don't even know if it was, I don't, and people were stating, well, it's not the debt. You know, people are upset. Well, it was, so I'm the new Quincy. Absolutely not. Quincy was his own individual, on his own individual. That, you know, they have their five, you know, I'm the new five. No, stop the lies and stop the nonsense. I met with the mayor, have not met with the mayor, but if there was something to move Flint forward in meeting with the mayor or whoever was required, and it was something that was important to the residents to benefit, like if he said, hey, Tonya, I need you to come to a meeting so we can get $1 for Hasselbrink Center and do it for 10 years like my part. If you can sit in on that meeting, I would be in that meeting, because it's about doing what I feel is right. So the mayor, I have not met with him, but if it is something that I felt we were advocating for the community, that was right. My advocacy for Hasselbrink has been clear, that, and actually they started out at $4,500 a month for their rent. Then they came up with the ridiculous amount of $2,000. Then they said, oh, we negotiated down to $500. If you start at $5 million, negotiated down to $250,000, you're gonna be like, oh, I started so high up here. Now it's a good rate down here. So I don't know where this council is going to be. I really and truly don't. I do not know. But what I do know, and we're gonna talk about before I get into some the election for the first ward and the third ward. If you want to change them seats, take some of this energy and help me knock doors, because that's what I've been doing. Help me knock doors. Get me some help. I would like 6 votes. What I would like to see is Liddell sitting in between Carol McIntosh and Beverly Biggs or AC Dumas. That's what I would like to see. Help me get some votes. Help me knock doors. Buy them a roll of stamp. Donate to their campaigns. Donate to their campaigns. Help me get 6 votes. Let's see Liddell sitting between Carol McIntosh and Beverly Biggs or AC Dumas. And then let's get some work done. But until we got 5 votes, I think the energy has to shift to actual work. We can sit on here and talk about it, but we got to get out there and help to elect people. We have to. We have got to. Tracy Jones says, while other seniors continue paying $1. Tracy, they are. They are paying, actually some, the facilities, they're not paying anything. Burson doesn't pay anything, nothing. And their lease was for 25 years. And that lease, BB at the time was asking for 30 years. And Mayor Neely wouldn't give him 30. He wouldn't give him 30. He was holding out. BB had given a recommendation, wrote a letter of why Mayor Neely's uncle should be out of prison, Miko. And that I felt was a swap. BB gave a letter, Commissioner Nolan gave a letter on behalf of Mayor Neely's uncle to support why he should be let out. And he was let out. And then shortly after, not even 30 days after, that 25-year lease was given. That is a fact. That is a fact. So, having Dumas might as well wake up Quincy. He took money from Ashley Capital too. Okay. Well, we can put somebody else. It could be Carrie Nelson. And so, and one thing is, I'm out there knocking and talking to people and knocking doors. I can tell you what I know and what people are saying, not because I'm speculating, because I'm doing the work. And people, our community is split. So, and some of these votes are split. So Michelle says, so ask for the resolution 16 million again agenda to see how they allow. Michelle, the rules changed in April. We cannot even put anything on the agenda. My stuff that I send up to put on the agenda, you cannot put anything on the agenda, period. I put on it to talk about the water a couple times. Candace denied it, and so did Liddell. They denied it. The rules, which I didn't vote for that goofy rules, and I'm not supporting them. The rules don't allow not even the city clerk to put anything on the agendas. It does not. So how do we change that? We got to have 5 votes. We just do. We have to. John G said, whose doors are you knocking? Not the third ward votes. I have asked Beverly Biggs, I have supported her program. I told her with her walk list to let me know when she's walking. I have told her that. So yeah, I have been helping with those campaigns. Any way that they asked me, I have been helping. So Mark has Ms. Burns says, if you hold your vote, you can put what you want on the agenda. The game is, I absolutely understand the game has changed. Absolutely, that 4-4. Absolutely. So how they set these new rules up, the new rules are terrible. They don't represent, it gives them total and absolute power. So it's not just my vote. And that's what y'all have to understand. I'm one person. There are 8 people on there. There are 8 people who are actually on that council. And then they have to choose what they want on there, or what they want to vote for. So More reason to not to support moving item from committee to committee. I'm not going to do that. If it's something for a committee, that's where we do the work. That's where we talk about it at. And there are things I want to know. I'm not shutting down everything so there's no discussion. Voting on something to be approved would be that's something totally different. John, I see you on there. I've told you, John, get me her schedule. You and I have talked about that. No, I cannot do it today. But I told her to get me her schedule. I've told Beverly, give me your walking schedule. And I've told her where she should start at. And I told her I would help her with her walking schedule. She hasn't gotten me that. She has not. What is that? Mickey?
What?
What was?
Oh, because I just washed my hands. I was doing.
Oh, so Mark Hudson, Miss Burns, can you please step beside me? You fought a long time. You don't have to fight anymore. Exercise your authority. Listen, I'm not putting anybody in that seat. So I do want to talk about this election because there were some things that came up. Precinct 10, one is going to court. Number two, it is I don't believe in voters being disenfranchised. I've got a problem with that. So it's I don't think we John, I don't know if you have got I don't know if you have got your I don't know if you have got your court date yet. If so, if you can put that in there, because I don't know if they were. I thought they were supposed to give it to you this week. So um, when it comes to and John, I can do earlier in the day. I can't do evening, so she needs to do or I do earlier in the day. So she has like a morning for her walk schedule. I can do earlier in the day. So what happened with this? With no one knew that. Oh, I did not know that Councilman Murphy um, was ill to the point. And so when he passed away, um, he was in a recall election. The recall election had already been in place. The criteria had been met for having a recall election by getting the signatures that Beverly Biggs Levy did get. And she had, I don't know who all helped her with them, some other few other people turned in some of the signatures, but she had the vast majority and she did turn them in. This was important for her to change how the third ward looked and how the third ward was represented. This was important to her. So he passed away. So then it came to, they said the county and the city. The county and the city were kind of really at odds. Then there was the state. So the city stated that it's a recall election and you can't recall a person who's dead. The county said, well, he passed away while he's in office. So then you look at the state statute was silent on it. So then you have to look at they said refer back to the Flint City Charter. So the city and the county were both waiting on the state to make a statement, which they had stated the state won't make a statement. The state did finally make a statement, and the state said in the letter, you have refer to your legal department and your charter. So then you have to go back to section 4-10, section I think 2-10, 2-410, 11 and 12, and then it tells you. So a lot of this, and it's going to have to be settled in court. A lot of it, because the state was silent, the city has taken the position that they're using this. He was recalled, but then what some of the attorneys that I have spoken to have stated, it's still an election. Tim Sneller died while in office. And they said whether it was a recall, primary, general, or special election, the person still passed away. And that it did not matter when it came to that. So when we look at this one, it was a recall, but the election was already in progress. The election was already in progress with it because it already started. And so people were already voting. They were already voting. People already received their absentee ballots, and you could also go into the clerk's office. So then they were told, well, you can't vote anymore, and that you can't vote anymore. and that it's going to be stopped. And then the lawsuit was filed. So we're waiting for them to go to court so that they can make a decision. And I don't know how this decision will be. Um, I looked at, and I've talked to several attorneys, and so there's different ways they said of winning this case. One would be arguing that the voters were being disenfranchised because the voting had already started. The other one would be um, looking at the election. It doesn't matter where the election is, still was an election, that it was ongoing. So then it got into, to add another layer of, I don't even know what to call it at this point. Precinct 10, it was noticed by AC Dumas that someone in Precinct 10 who went to his church had not received a ballot. Received the ballot, but the third ward election was not on it. And so it was not. So I did call the county clerk and called the city clerk. So the county clerk did tell me that there's two different maps that they were working on. You had the map that the county was using and the city was using. I don't know how they would have happened. County clerk stated he did get with the state. He stated that his map was correct, and he sent it in because you have to figure out, and there is no number. They don't know how many people in precinct 10 did not receive ballots. They said they feel it's a small number, but there is no number yet. And so they've asked for a direction from the state of elections. I don't know how this is going to do and what would be the remedy. How do you remedy this? Because I don't want to put the election out and to where we going, with all these errors, and it be put out till May, which is what our city clerk was saying, that the election will be held in May. People who wanted to be appointed to the seat had until, I believe, 5 o'clock yesterday to 5 o'clock yesterday to apply. And then at some point, I don't know when the appointment process is going to be, but I'm probably thinking coming up within this next week, and they may hold a special meeting to do this. So the appointment process, we have seen that before. We've seen it in First Ward and Seventh Ward. And so the appointment process, I feel the person should be elected. I've always stated when we appointed people, I feel the person should be elected. We have an ongoing election. I don't know how many people, and I don't think we'll probably have any really new people be added to this. I just don't. I don't see that. I am not, because I believe in the election process. I don't like people being disenfranchised and stopping an ongoing election. The election is going, people have voted. And I look at the closest example would be Tim Sneller. And what they did was he did pass away in office. And what they did was just open it up to have people who wanted to write in. You could be a write-in. There are already 4 people left who are still on that ballot. So with that being said, we're waiting on the state. We're also waiting on when the court case that Lentil Law is taking that to court. So we have to wait for Beverly Biggs attorneys with Lentil Law for that to go to court to see how that does play out. And I don't know if, they're going to probably have to address that precinct 10 issue. And one of the remedies they said too is that people, there was a few remedies. One, they could have those, I don't know how many, they feel that it was a small amount that they could come in to spoil their ballot, and the ballot, they can get a new ballot and vote. Another one would be wait until the election is over. And so say if there were only 25 people that were affected, because precinct 10 is on the cuff of precinct 10 serves Ward 3, 4, and 5. So it serves 3 wards, 3, 4, and 5. That it wasn't a big amount of people, a large amount. So say there were 200 votes over and there were only 25 people that missed getting a ballot, that it would not offset the election. These are not my remedies. These are some things that have happened and how they could remedy it. I'm not saying they are, but this is how they could remedy it. I personally feel that the third ward people should all be able to cast a vote in that election. Let the election go forward like they did Tim Sneller. And what they did was just not count the votes that were given to Tim Sneller, and that's in Burton. And that just happened this year in our primary. So we will have to see what Lento Law with this case with Beverly Biggs. We don't have the date. Everyone's probably on pins and needles to see what will happen. They have stated that, and I'll let them play, let them their court case. But I think that this is a very winnable case. I personally feel it is. And listening to the different attorneys, I feel it's very winnable because the election was going on. So I am not. I don't like disenfranchising voters. I do not. I don't like disenfranchising voters at all. So we just have to wait and see. They have filed the paperwork. I have not had a chance to read the paperwork, the filing. I have not. So I can't talk about the filing. Johnson, what did he say? Melissa, know what you were talking about. Every case is still pending. Okay. Well, I guess it's something going on in the chat. So I have not had a chance to read the case, but I wish Beverly Biggs the very best. I hope she wins. I hope she wins her case. And she's fought very hard and very diligently, very hard and very diligently. So I want everyone put your support behind Beverly Biggs. And she did a great interview actually on that was in Mid Michigan Now or TV5. She did a very good interview, and so this will be interesting. This will be interesting. So everyone can stay tuned to that. Mark Henderson, it's a winnable case, but will it be delayed until after November? So it will be a moot point. You have the decision and appeals push Davina to schedule the election. Listen, Davina is listening, and this is the part that I don't think a lot. You can't push Davina to do that. She is really steadfast on that. The conversations, and it's her and the county clerk, and so the case is going to push her to do it. I believe they're supposed to respond to giving a court date within 72 hours. I don't think they've done it yet, but they should at any time. They should be given. They should be given her court date, which everyone will be waiting on. So she has continued to fight. She is running the race. She has not stopped. The court case. I mean, the court case will be pushed. Let me say the election to get the election will be pushed by the court case because the city has already made their position. The city's position is they're going to appoint someone, and they've already started the process. They've already started the process. It was posted on, I believe, what's today? October the 4th. They closed it on October the 11th. So it was posted October the 4th. They closed October 11th. So the city's position now is to appoint someone. That is the city's position. And the only thing can stop that is the injunctive, I believe it's an injunctive order that they put in, would be the court order. And she has representation with Lento Law, and Lento Law is taking this case to court for her to see how to fight for justice, because this was an election that was already started. So somebody said, I'm confused. Having Flint residents been saying they don't want people living outside the city. Okay, Philip Lee. You don't have to be confused. That's who her attorney is, and she's her attorney group and very good friends. M. Salter, you need 5 votes to appoint. Yes, you do. You absolutely do need 5 points to 5 votes to appoint. And I am not appointing someone to that seat. I feel that seat needs to be elected, not selected. And I'm not changing that. It needs to be elected, not selected. But if you want to help, put out, come out and help, knock doors. And John, Beverly needs to get me a morning schedule. She needs to get me a morning schedule. And she hasn't gotten that to me. But Beverly has been fighting. And I look forward to seeing how this is going to end and to work out. So that's why nothing changed. People are doing them dirty, and their neighbors and people they grew up with. I don't even know what that about. Okay. So anyway, so there's a lot going on with our election process. Mickey, what is you got somewhere you got to be?
Yes, ma'am.
So there will be a part 2 to this, because we didn't even get into some of the things. I wanted to do an um, open and transparent. And Salter, I don't know if she has Saturday schedules. Beverly has a website, and if you can probably, and I don't know if she does Messenger, and if she does Messenger or not, but on her, yeah, inbox her on her website then, on her Facebook, um, and then to contact her. If you can't, if that doesn't work, then you can contact me, send me your information. I'll get it to her. But if you want to, um, if you want to change the council, help out. Vote for Beverly Biggs Levy, vote for Carol McIntosh. If you want to change the council, you got to change the people. We will not change. I'll find out what's going on with the ARPA. And if that last meeting, if y'all listened to, you would have heard Judy say, we working out deals behind doors, closed doors. And I don't know if y'all caught that part. So in other, it doesn't matter. It has been what they call themselves the big five, the big five. And so the big five is not changing. But I do want to talk about, listen, y'all, I got a call this morning about these trees right before I came here. You have to hold up a minute. Put the picture for the trees. I literally got a call about them trees. Now y'all know during that council meeting, because y'all done roasted me on everything else. Them trees did not, I think that it went back to another committee. So if you can see in the picture, these trees were cut down, like up in that corner where they were hanging over the garage, and the trees were trimmed. They were hanging over the house. And so you can, can you blow it up with like the tree part, please? And so the tree program, I got a call was this before I was on my way here. Are you supporting the tree program? I actually like the tree match program because I've got a lot of people. Flint's got. I didn't know trees were such a big problem, so it really ticked me off. And I'm gonna have to set some new boundaries with some people, because my vote is going to be my vote. But don't call me with. I don't care what Mayor Neely was talking about on his show. I don't. And his thing is to always go and put the people against the people, and they're not voting for the trees. This is a great program. Council can't make a decision. He gaslights this community. So these trees were cut down, and the house next door to it, as you see, it's an empty home, a vacant home. And so I talked about this during council. Now the pictures have been taken down, to my knowledge, off of Facebook. Because when they said, well, there aren't pictures. Well, yeah, they are. I had already screenshot them. And so the pictures of the trees, where if you take somebody out for a $12 Cracker Barrel dinner, you get endorsed and you get trees down. Well, my residents are now saying, well, and people have called and said, how do I get it? He didn't pay nothing to get those trees cut down. He didn't pay anything. How do I get mine for free? And that is a legitimate question. How do I get mine for free? So they said it was taken down. I haven't had a chance to check, but put up the picture of who got the trees. So people do it's for endorsements. So you can see the trees were hanging on the roof, which they do deteriorate the roof. And so I didn't say the person's name at the council meeting. But Councilwoman Liddell Lewis, they said, if a hit dog holler, a hit dog will holler, whatever the saying is. So the trees were cut down. Interim Councilman Leonel Alameen took out John Billings to Cracker Barrel for a $12 dinner and asked for his endorsement. I was told Mr. Billings has met with or talked to the mayor. And what happened as a result? He got some trees cut down. Trees were cut down for free. So this had been an issue with him for over, I think, a year with the trees. And so They said if you watch that entire meeting, and I know people had to switch from going on 810 over to the official Flint City Council. Go back and watch the official Flint City Council. Yes, the meeting went off the rails. It went completely off the rails. So the tree program initially in its thought is a great program, but when it is misused for Johnny Billings had 60 votes in the election. He had 60 votes. Leon called him up and met with them. Next thing we know, $12 dinner. He got some meeting with the mayor and talk. He got some trees cut down. He was very close to Councilman Mays. I'm really disappointed in him. He supported Councilman Mays so much and was there and supported. I am so disappointed in him. So disappointed in him. And now he got the trees cut down. So Clyde Edwards told me those trees were not cut down. This did not happen. He can't believe it. Send him the pictures. No, y'all can see them. They're all over Facebook. They're all over Facebook. So then they try to say, well, what is this, the new tree program? Where they're the conservators. Looking at a tree and cutting down a tree. Come on. Diagnosing the tree. Those trees were cut down. They were cut down. So then you look at, who he's meeting with, who he's talking to. I'm disappointed in that. So looking at the tree program and concept, great program. Looking at the tree program and how it's being used, and people are getting trees cut down for free for a $12 Cracker Barrel dinner. And then, a photo op. It was like 8 photos in there. I'm just disappointed. So disappointed. I got a call this morning too about the tree program and what is the mayor talking about. Disappointed in that. I don't like people calling me to ask me what my decision is based for my residents. And if it's somebody's calling me about the mayor and what he's saying with the mayor can call me himself. He got my phone number. When I had that drive-by shooting, the state rep called me, and I know he was on speakerphone. My number has not changed in 25 years. I'm reachable. He can call me. If he had a question about those trees, he could have called me. Now, what he's going to do is say, Tonya Burns is not supporting the trees. No, Tonya Burns is not supporting interim councilman Leon L. Alameen getting trees cut down free. I'm not supporting that tree program. If he can do it for Leon for free, we don't need to be telling the residents they need to buy in for anything. Let the residents get them free too. Residents have to buy in $500 to $1,000. Let the residents get it for free too. You get a tree cut down, you get it for free. Or pay it for a $12 Cracker Barrel dinner. You get it for free. So we're going to do a part 2 to this because emotions have been running high, really high. And y'all keep Beverly Biggs in your prayers with her court case, because I am. If you want to change issues and things on the council, I would like to have 6 votes. 6 votes, we need them. We need 6 votes. We need to change this. And so how can you change? Donate to their campaigns. Their campaigns are all listed on social media. Call and ask them, inbox them. How can you help? Michelle said, how many votes do you need to change president, vice president, and finance chair? 5 votes. We need 5 votes. 6 would be good. 5 would be great. 5 would be great. So, and a lot of things, and I didn't do my show last week, sinus problems. It is so much more to
like 4 minutes.
Okay. Okay. Can we do a part 2? Not today.
Yeah, I would, but we got to.
No. You give me a day.
I'll figure it out.
What about tomorrow?
I kind of have my day off. I'm trying to tie it up the whole.
Okay, so what I may do a Facebook Live tomorrow, everybody. So see the post on my page because I want to finish up a couple things. So I'll see and I'll post it on my page. If I'm gonna do a Facebook Live, I'll just switch it to mine. Mickey said he's going to be busy because there's a lot of information that needs to be put out there, and I didn't get to even half of it. So So, anyways, I'm gonna let it go. I hope everybody has a good weekend. And listen, and if any of y'all know how to contact me, if you want to contact me, if you got concerns, you want to talk about my vote, inbox me. I will give you my number. I don't have a problem with it. I will probably do a live tomorrow and do it on my Facebook page. Be ready for the post. And Chris Cab, I got my mother. I got to deal with. When I leave here, I'm going to see. I got to do some things for my mother. So listen, I appreciate everybody coming in. And I will talk with you all tomorrow. There's still some more. If you want to help donate to their campaigns and elect Carol McIntosh first ward, elect Beverly Biggs third ward, and we have to change those seats. We got to change those seats. Thank you, Mickey. Look, y'all enjoy your day, and we out.
Okay.